Chukwemeka. I'm from Abia State, Isi Alangwa side to be precise. We are here to talk about the advantages of technology to our present day. And I'll be talking about, as a medical practitioner, I'll be talking about the advantages of technology in the health profession. Why is it that, what is the benefit? What have we gained from technology concerning our health today? Number one is, in the olden days, I came to find out that in the olden days, whatever we don't have explanation for, we worship. Whatever we cannot explain, we worship. That was the advent of Obanje. Mmadu mụrụ nwa 3-4 times. Ya nwụọ, ya sị na ọ Obanje. And that was a god. That was a god. Uche Chukwumelite, I would want to tell you something from a fact, from statistics. One of the things that was the advent of technology took away from us is unsafe childbirth practices in Nigeria. Melite, as of today, every 7 minutes, a woman dies from unsafe child practices in Nigeria. Every 7 minutes. And according to World Health Organization, 200 women die every day in Nigeria, according to unsafe birth practices. 200 women die in Nigeria every day out of childbirth. And globally, Nigeria, which is our country, is contributing up to 28 to 29% of childbirth. So in Nigeria, if 100 women dies out of childbirth, 28 to 29 is from Nigeria. And this is even after the advent of technology, after the advent of technology. So you can compare, you can now contrast what was happening in the last 30, 40 years. Even the advent of teaching hospitals, federal medical centers, Chukwumelite, the people that is killing people most in our society, in Nigeria, in Igbo land, is these people that call themselves TBA, traditional birth attendants. They are not trained, they don't want to get trained, and they don't want to do anything. And our people, you see somebody that went to school, you see a graduate going to Eban Eni Ogwu Eriri, Eni Ogwu, Asa Ogwu Okumni, and now Pari and Wanafo. Even at this time, people go through it. And when they go through it, Yakwo, Ebutazionya on a hospital, helpless. In that time, they might not have the money, they might not have be ready enough to go through the emergency process they'll be asked to go through. Chukwumelite, I've operated on a woman the first time, operated on her the second time, and do the third time, the mother-in-law see that. Now the third time, no get more operation. She came to me, I explained to her about the dangers of the decision. The mother-in-law, the woman assured her and it is a rule in medicine. Once you make an operation for a female, the first one, made the second one, the third one is going to be cesarean section. Otherwise, the womb baka and obaka, that woman would die within the next 30 minutes. And she went there. The woman gave her some drugs. Contraction ebido. The woman contracted, the womb ruptured, and she died. I told her. So the advent of medical technology, even at its peak, now people are still dying. Now another thing. Technology.
Interested interested because he make now with distraction to the program. Please, you need interested. Actually, I'm here serious here. People, and I want people to learn from this discussion. Doctor, go ahead.
Melite, The second thing the advent of medical technology brought for us is stopping female genital mutilation. In the olden days, it is believed by culture na and if you don't mutilate the genital part of that woman, that lady or the baby, that in the future, that thing was just for culture. That thing was just for culture. Menije, even at the advent of the height of medical technology, globally every year, 44,320 female children die yearly in the whole world from this female genital mutilation. It was just for cultural reasons. In our present days, even those that was mutilated and those that were not mutilated die from it. Now, Melissa, we need to understand what is the dangers of this thing. This surgery is a surgical process. This surgery was performed by people who didn't finish standard 6, who doesn't know the anatomy of a woman, who wasn't ready to stop bleeding in severe cases. There was no antibiotics to give to somebody you did such severe surgery for. So most of them today are suffering it because that old woman that doesn't know anatomy, doesn't know where to stop, doesn't know what to cut and what not to cut. People die from bleeding. Bleeding will continue in days. The baby will become anemic and die from it. Infection will come into it. Women, those babies will die out of infection. And a lot was happening. Another thing that is still killing our people, despite the advent of medical technology, is try and error in herbal practices. You go to a woman or a man, she will tell you that she's healing with herbs. She's healing you with herbs. Menije, that is false. I want to explain to you how drugs, because some people will come up and say, are drugs not being produced from herbs?
Herbal medication. Can you use
herbal medication? Very good. People will come up here and say, drugs are produced from herbs. I am here with the answer. Menije, every herb has a positive part and a negative part. Menije, there is a herb in our place. There is a tree in our place. In those 18 days, if your goat is destroying your farm, you go and boil that over the leaves and use it and apply it on the teeth of that goat. If you, after applying it, you can use a stone and remove the whole teeth, it won't pain that goat. That leaf has a negative part and a positive part. If you also apply it anywhere, if that goat drinks it, it's also going to paralyze both the heart and every part of that, which our people didn't know. Now, these were the ways we were using it. You go to somebody, tell the person that this is happening to you. The person misses 100 leaves and gives you to boil, without knowing that every leaf has a negative part and a positive part. Now, what science does is, science will X-ray that leaf, extract the negative from the positive, and will make use of the positive ones on what we want. Most times, a particular leaf can have two functions. If, in fact, a leaf can have a positive one and have a negative one. Can have a negative one and have a positive one. Then at that point, what we need is a positive one. We will X-ray it, remove the positive, remove the one we don't want, and use the one we want. But in herbal practices, that person doesn't even know. There was no study. Okay, dear home, welcome. There was no study. Somebody was just doing it, believing. That is what my great-grandfathers told me. The advent of medical laboratory came in 1912. The first pathology lab was established in Lagos in 1912. That has helped us to diagnose, to know the extent of diseases, to know their cause, to know what the right drug to use to be able to tackle it. Melite, as of today, if a woman is having what we call vaginal discharge, that woman will go to the lab and will do what we call high vaginal swab and culture it. By doing high vaginal swab, we want to know the species of microorganism, bacteria that is causing that thing. If we want to, furthermore, we want to know the antibiotics. If we use it, if we use that antibiotics, that disease will go. That is what science has brought to us. As of today, there is a test that can say if a woman will develop cervical cancer in the next 2 years. Cervical cancer in the next 2 years. Obidobe now. But if there is possibility of that cancer coming up in the next 2 years, it would we can detect it. 2 is as of today, we can know the state of your heart with the use of X-ray. We can do other tests to know the state of your brain. Not gazing. The era of gazing has gone. Nobody is now gazing. People want to know what you're treating, why you're giving them this medication, why they need to take it 2 times in a day, why they need to take it before they take their meal or after meal. That is the stage we are. But some people are still archaic, some people are still backward. They will go to somebody who doesn't have any certificate, who doesn't have anything that will tell them, take this herb, mix it with this one, mix with kai and take this in. And they are taking it. And most times, those things don't just take care of that sickness, they kill the kidneys. It is in the history, statistically, the advent of increase in kidney failures is because of, one of them is because of high consumption of alcohol, like kai, through herbal concussions. Why is it that every concussion they will give you, they will tell you to mix it in kai or mix it in snap? These things were things we can't, that doesn't have an answer. They don't have the answer. Number 4, Melite, it was believed in our place that if anything is wrong with you, you go to a native doctor and get a diagnosis. A native doctor will do some concussions, sing some songs, and tell you this is what is happening to him. That is what is happening to him. This is what we are going to do. And in most cases, after doing what he asks, after doing his beads, what is happening is still happening. Melite, in 2003, I had a woman presented to my hospital. And from history, I was told that that woman has been pushing for more than 24 hours. She has been pushing for more than 24 hours. I advised and I examined and found out that the woman has gone into what we call exhaustion. That woman she's exhausted. There's no energy again. She's not crying anything. Only you know, there's no strength again. And she was presented. Melite, do you still know that when I told them we need to go save the life of that woman, we need to save the life of that woman immediately, some elders came and told me that it is because of na mbaloru the lady na emera mmanya nwura anwu ihe na owu mmanya ji nwa apụtara. So they needed to go to a native doctor to do some things to the grave of the mother, so the mother can allow her give birth. That if they don't do it, that she's not going to give birth. Many times I told them that I convinced them to give me some minutes, let me go into the theater. If I operate on that woman, let me see where the hand of the mother will come out of the grave and hold me, not to bring out that baby. After a long conviction, I told them I was going to invite the police because that woman would have died there. Out of fear, they accepted. Manage in the next 30 seconds, the baby cried. In the next 18 minutes, the woman came out alive. These were things that have killed a lot of people. Some people died out of exhaustion. Some people died out of what diagnosis native doctors gave that were not true. A lot of things were happening. In those days, it was believed that if there is any swelling in your body, which we will now see as a clinical sign of kidney failure, it was believed to be the punishment from God. It was believed to be the punishment from God. There is a popular disease now we call benign prostatic hyperplasia, where a man can no longer, from the age of 45, 50, can no longer pass urine easily, because that which is regulating the passage of urine and sperm is swollen and contracts the urethra, the tube that passes out urine. In the olden days, it is called a wimbachiokbo in our place. And once it happens, is a belief that you've slept with a woman that has infection. And a lot of rituals will be performed. People died out of that condition because there was no remedy. But today, we just need to pass catheter, and that woman and that man would regain his freedom and will regain his health and will manage that benign prostatic hyperplasia. Second to the last, there are in Igbo land, there are some diseases that we are believed to be caused by the gods. Most of those diseases were common illnesses. We are common things. Till today in my place, a higher percentage of people still believe that stroke can be sent. Stroke can be done by the enemies. It is very, very difficult to convince people that stroke is a physiological and is a medical condition. Go to herbal homes today. You see some people, believing that, thinking that stroke is something that was caused by this. I want to explain the pathophysiology of stroke to you. There are two major veins. That supply the right brain and the left one. And is a known fact that the right brain controls the left side of the body, and the left brain controls the right side of the body. Now, there is a big vein that supplies blood to the right side of the brain and the left side of the brain. And if anything happens, in severe cases of hypertension, anything happens, the vein or the artery that supplies the left side of the brain ruptures. That part of the brain will no longer be receiving the adequate quantity of blood the brain needs to function. That part of the brain shuts down. That part of the brain shuts down. So far it's not receiving enough supply. The anatomical functions will drop. That part of the body will go down. The mouth will shift to that side, indicating where the fault is coming from. But today, a woman that didn't finish primary school will tell you, stroke. In fact, in my place, stroke is called mbamo, means it is caused by the gods. So the advent of technology has brought a lot of, now, if you want to know, and there are types of stroke. There's hemorrhagic stroke. The pipe now supply that part of the brain was ruptured. Now, another one is ischemic stroke, where due to loss of enough blood supply, that part of the body gradually lost function. And this thing is what technology is showing us. This is what technology is giving us. Today, You can walk into the hospital and say, I want to know the state of my prostate health. And an antigen will call the prostate specific antigen will be tested. We want to know the state of your prostate. And we'll know whether there is, in my family, there is history of that prostatitis. So, to me, I am taking my prostate health daily. I'm taking my prostate health daily. My dad had that issue. So I'm taking my prostate health daily. Today, if somebody dies suddenly, we can do what we call autopsy to find the cause of death. In those days, you go to a native doctor, and a native doctor will do some things, and you hear a voice that will tell you that this is what killed this person. But today, we can put the person on a table, open up, and bring out all the organs, examine them, and tell you the exact cause of death. It's known today. Menije, the advent of a technology on the medical side cannot be overemphasized. Today, our women they are no longer dying out of exhaustion in childbirth. Our women are no longer dying out of exhaustion due to medical complications. Our women are no longer be in labor for 2-3 days. Those days, the woman has been pushing for 2-3 days. There is now an alternative. A cesarean section can now be performed. In those days, there were no drugs if they needed to suture any wound. But today, surgery can be performed on you, and you won't even feel it. You'll still be alive, and they'll be operating on you. You will still not feel it. But it wasn't in those days. I think with a few points of mine, I've been able to convince you and not to convince you that at the advent of medical technology brought more good to us than bad. Thank you so much.
Okay, nga akpọlite ụka ọnụ. God bless you. Ụka ọnụ. Akam need the one person gano on the side of Dr. Sam and the GLO home. Because Okono and the Waja is like is like five man squad. Okono when he give Okono.
Okay, Chukwu Merije. He gave na
kaine emetuni ananka because all them ka doctor kuruku on in a very lengthy time. Team time. 5 minutes. Just come give 5 minutes, please. Go ahead.
Okay. Ihe ga-eji mara ndị riri ma ndị gara ụka akwụkwọ too much mgbe ọbụla ha bidoso oyibo dịka mmadụ doctor. My opponent, he could have working
no insult, please. No insult, please.
He had debate. I had debate. I'm not going to lose attention. Give me out. He gave him and then when he got to school, and then this was not so open. That grass school, come out doctor opponent. He jama sauce English. I come when he was summer. He said, "This is a book. When he got to now, doctor, let me not embarrass you with the truth that he actually pay attention to." Doctor, even a family get now, ask about your ancestors 2 or 3 in retrospect. Okwa na eme because ndị grass na amata here. Ị ga flat na ndị nne na nna gochie gara aga. Enwere ka akpọrọ galo ụlọ ọgwụ before. Onwe nke nwere tablet na aṅụ to the poison na aṅụ to the boy ọgwụ. Doctor, unu bidoro ọnwụnwa ihe today based on agala aga oyibo. Doctor ka njụọ gị ọgwụ ahụ ị na-emere ndị mmadụ prescribe n'ụlọ ọgwụ. Ịma content dị n'ime ya. You don't know. Ima content in edere mmadụ jidere gị sọtụ dịchara gị sị gị na gị nwụba. Onwe ihe manụ n'ime ya. Mana nke ịma na village gị eji mgbọrọgwụ na akwụkwọ na-aṅụ ịma ya ịfụ nke ahụ kpọọ ya primitive. In your statement before, you called our ancestors primitive. Ọ bụ ị na-aṅụ today, vaccine ahụ na-aṅụ today. Ịma ihe nọ n'ime ya. Ọ ihe a gwara gị nọ n'ime ka ọ nọ. Enwere nke ịnwala. Doctor, ihe na-emegbu ndị niile gara school ka gị nwa. Because unu bịa sunu gụrụ school. Gwagodi m onwe ọgwụ ihe pụtara n'aka gị nwa onye doctor onye gara school. Gwagodi m ihe pụtara. Enwe ndị snob ihe pụtara. Enwe ndị gara school sị gị ihe pụtara. Mana ị ga na village kịta na ị ga-ama ihe ndị nna nna ochie pụtara. Ịfụ mgbọrọgwụ na akwụkwọ ịma ife ọ na-arụ because why? You can see it physically. Ịma ya. Mana gwagodi m ihe today. Enwe ihe nọtara ihe na akwụkwọ doctor Here in this okay school, here in how he not in your life, I quote, previous ancestors who onyenka weku, and when king of women, here little crocodile for chapi. Doctor, come wagi, nani ma deborando, ane dendo before Ichetega school. No bro na akpakwo ka eji wee nwụọ gị na iji wee shi ike till today mana onye ọcha ị ga-eji survive n'obodo ndị ọcha survive n'Africa mana onye ọcha ma survive n'Africa. Ịma why? Anyị ma ha na-akpọ ọgwụ. Mgbe gboo enwere nwaanyị Igbo na-amụ nwa wee nwụọ. Dọkịta ọdụka mmadụ gị ndị gara school dabịa kụziri ka a na-akpọ ọnwụ. Ọdụnwa dọkịta ọdụka mmadụ gị ndị gara school ndị ọcha butere unu dabịa gwa that na nwaanyị nwụọ a ga-eme nke a. Tilimtocha na village eto na village amụ onye ọka igwe dọkịta. Tilimtocha na village afụ m ebe nwaanyị na-amụ nwa wee nwụọ. Oge m matara ha na ifesef mụ efugodo osu sef na afegodo arụ mgbe m matara ha na-akpọ ọnwụ mgbe m pụrụ ọnọdụ ije. Mgbe ha bịara mewe western world dọkịta ka m kọwara gị
ụkọnụ chere I feel like the conversation awụhụ ịnọ na akanta doctor gwa anyị ihe mere ndị Igbo ji aba into business hapụ ịtakụlụ ya then ịgwasị anyị gị bịa rutu aka ihe echere rutu na ihe doctor kwuru but ihe m ji kpọta gị oke ịgwa anyị ihe mere ndebe anyị ji aba into business instead of ịbịa rụwa ọrụ oyibo ịghọtago ama m ịghọtara ihe m na-ekwu ya wụrụ na ọwụ ịgba bọị otu ịma ihe gbasara ịgba bọị gị gwa anyị ihe mere ịgba bọị ndebe anyị ji aba ịgba bọị kwuo nke gị convince anyị na nke gị ka mma rather than ịtakụlụ nke onye ọzọ.
Merije, the debate is to make your point pointless. I have to neutralize your own point, then I will give my own point. I'm laying a premise on how to make doctor lose his focus. That is how to do it. I want a debater. So I'm here to make his point pointless. Give him point, even him will start to agree with me. This is why we are in debate. So, doctor, you have to agree with me that whatever I say here.
Doctor, na debate, you get more opponent, you debate, yeah, neutralize your point. You always you gonna write down.
So, I got a debate in my primary school. So, doctor, you have to agree with me that na ending today because of the knowledge of our ancestors. Now bring it back to Chukwumerije. Ega school, I will agree with my opposition that it's Ega school. No one advantage. The only advantage I can see, Madiso Ibo, the ability to represent yourself, academically in crowd. That's the only thing I can say your Western education brought. Now let's bring it back home. Chukwumerije, do you know, will you agree with me that almost every educated Nigerians today are pure illiterate? Let me tell you why, Chukwumerije. After Hagachi school, they will still come back into the realities of now. And what is that reality? Hagacha school, to fusego hagejime business, habia mwakoro. Chukwumerije, 95, if not 99.9% of ndị Naga school in Nigeria today, gbajiri ego, no hook up, zuo moshi, wee ka ha nwete asambodo certificate. Mana ọ bụ na ego ahụ na ha save ya were ga more business before gawa school later. Chukwumerije, agụ aga dị na buy. That is why President Usinu unu will lazy youth. He was 100% correct. Because why? You don't have any hope. You will source Igbo. You will source Igbo. Onaka, you will your friend one pair Diego. A gawa school. Na ga go akwụkwọ. Imakwa that you cannot maintain. Ego chakwa ya Chukwumerije. E batakwa internet say ego cha school. Niche ga amu eba na go no Chukwumerije. What kind of education will you get that will make you lose focus of who you are? Then allows you to think about who you are. Chukwumerije. Education in Amu today, of Western education, I totally disagree with it. We are the constituent of education already, Chukwumerije. Chukwumerije, turn na shop market. When we started this conversation, you watch I don't have CCTV camera now. I'm inside the security room. Na shop not I am professional in this, so I'm more educated than doctor. I am more educated than only people I have that will oppose you. Chukwumerije, in this point, Chukwumerije, I'm in business. I studied business for complete 8 years from my master. Onyem certificate we do. That is business. That is education. Chukwumerije. Chukwumerije, enwere ọtụtụ ndị mmadụ ha na today gacha school. Ha gara school ka ha nweta asambodo today ha na yonni. They are begging for food. Do you know why, Chukwumereje? Because they don't have anything to present except the certificate. Chukwumereje, certificate cannot give you food in the table. Certificate cannot give you that food. Nigeria and Okita Chukwumereje, majority of them are those people who are educated. They only have certificates, but they don't have food to the table. Chukwumereje, what can give you life is what you do for yourself. Chukwumereje, education is the ability to solve your problem within. Pay attention, Chukwumereje. Education is something that can make you solve your problem. If you cannot solve your problem by yourself, you are an illiterate. Did you hear that? If you cannot solve your problem, doctor, if you cannot solve your problem without external help, you are an illiterate. Doctor, let me tell you why you are an illiterate. Before you administer your profession in a patient, you have to wait orders given to you by your superior. By Ndochi Buteregog, Mandoche Buteregog now, Magma doctor, by your patients will die. All of them will die. But in our own culture, in our own education, in our own system of education, we don't need those people. I buy me more hapata dog, Nyonya, Hadin Dozbo. I need a go Madoria. I na walk on a orthopedic. I na go healing down before Dutcha Webia. We need anybody. I get check and Dutcha with Tranya because why? The solution is within, not external. The solution is within. It's inside of us. This is who we are. Manakima doctor. Kenji krage maketa now. Oria guam keta na. Oria biam mechontem bani moya. I find my own solution. Why you depend on people to give you solution? Can't you see that I'm more educated than you? Doctor, I am more educated, well exposed, well inclined than you that solve my own problem 100% without depending on anybody. But you, before you solve your own problem, you have to wait for somebody to give you solution that you don't know. Doctor, with this viewpoint of mine, before other people speak, I will beseech you, I will also pray that you should leave this your Western education and come back into the realities of African culture. You will be saved. Your mental cycle will be 100% okay. Because you, to be honest, doctor, you are more illiterate than illiterate themselves. I am more of an educated man. I solve my problem. I have solutions to any problem that is around me without even waiting for anybody. But for you, you cannot do that. Thank you very much, ladies and gentlemen.
Okay, Doctor, respond quickly. Doctor, we'll 3-4 minutes respond. Then we come to GLO Holmes.
Thank you so much, my opponent, Mr. Okono. From the point Ikuru, Okono isn't in on a CCTV. Now monitor hagi. CCTV, or technology, or one pagging on ya. Or we are great grandfather on CCTV. Without technology, Igari can search umonogi, now searching one after the other. That is one. Okono, I also want to believe na idorian in a pier in South Africa, Abamborogo, Enango. Thirdly, Okono, I also want to believe that trek I also want to believe now who cook trek from Nigeria, to South Africa, neba plane, or who play the boogie, or who motor boogie. Okono, I also want to believe that na iya not na zongo fan. Niyaho now your great grandfather, Mania. Okono today, I can now be in the United Kingdom, in on South Africa, Meriji is somewhere. What Mr. Wajawad is somewhere, GLO Home is somewhere, and we'll have a common debate as if we're in one room because of the benefit of technology. You are where you are. You are talking to me. GLO Home is looking at me. Mr. Wajawad is looking at me. Chukwumereje is looking at me because of technology. What did your great grandfathers produce? What did they produce? In an law. It is CCTV. I monitor. I also want to see. I also want to believe. Nihinere wumbrogo na mpakwukwo na akirika na aja wihende nna nani ga na use because even now attachment was produced with technology. In fact, Okono ihe do wara gindu today with technology. Attachment in erere with technology. Cream in erere with technology. Okono, you need to go and practice ihe ị na-ekwu, what you are practicing today, it is not technology. Until you give them na ihe na-erewu mgbọrọgwụ, ihe na-erewu ka ihe mefutara from mind ngwọ, na ihe na-erewu na ọwụ plan ka iji bịa, ọwụ plan ka iji bịa South Africa.